Hello, I'm Carol Burrell, President and CEO of Northeast Georgia Health System. I want to thank you for taking a few minutes out of your day to watch this video. Now that may seem like a trivial thing to thank you for, but I know how important your time is. When you're working in a growing health system like ours, it can feel like you never have enough time to get it all done. Whether it's giving all of your patients the attention you think they need, having that one important conversation with a coworker, getting a critical project done by the deadline, or even stopping for a minute to take a deep breath. As the world around us continues to speed up too, it's easy to occasionally feel overwhelmed and lose sight of the positive things we each impact. So while you're taking a time out for this message, let's recognize all the good you and our teams throughout the system are doing. Think about that visitor who thanked you for preparing their meal or ringing up their order. Think about the patient who thanked you for simply listening to what they had to say. Think about that story you saw on social media about our emergency department nurses winning a national award, or the one about our former Nicu patients and their families coming back for a joyous reunion, or the one about a heart patient who traveled all the way from Texas to have heart surgery in Gainesville. As our region's population grows, those are more lives you will positively impact. And when we grow to add a new location, that's one more place where we are helping people. Together with the community, we are growing the greater good. That's how we'll start referring to our major construction projects moving forward, to remind us why they are so important, and they go way beyond bricks and mortar. Today, I'm extremely excited to share a new project with you. It's our plan to transform the Northeast Georgia Medical Center Gainesville campus to better serve our patients and prepare us for the future. The plan has been developed with input from groups of frontline staff, physicians, and leaders in key areas that will be impacted. We'll be getting more of you involved in the planning process, and I'll talk about that timing in just a minute. I'll also share some exciting changes coming to Brazelton as well. First though, let's talk about the improvements we have in mind for Gainesville. Here's a bird's eye view of the campus. Our plan is to build a new multi-story tower next to the North Patient Tower, which will create several opportunities for improvement, including relocating the emergency department to the ground floor of the new tower, in space specifically designed to care for the volumes and types of patients we're treating. Adding hundreds of new parking spaces near the new tower, which we all know are much needed. And moving some beds from the South Patient Tower to the new tower, where our highest acuity patients will be closer to the new emergency department, operating rooms, imaging areas, and other services that support their care. This project also gives us the opportunity to expand our surgical capacity over time, create a more visible community destination for our interventional cardiology services, and grow some of our specialty programs such as stroke, neurosciences, robotics, and trauma. This plan also gives us an opportunity to envision the future of the South Patient Tower by adding new beds, renovating rooms, and upgrading to a modern look and function. The possibilities are endless. During construction of the new tower, we'll work with all of our teams to decide what the future looks like for the south end of the campus. Before we start digging shovels into the dirt though, remember a phrase you may have heard me say before: everything touches everything. We need to be intentional about each step in the project to minimize the unintended consequences that a change in one area may have on another area. That's why this project has 3 phases. The first phase is planning, which we recently finished. Now we're moving into the definition stage. This is when we validate all the plans made so far before moving into design. We'll do this through conversations with staff at all levels, ensuring physicians, nurses, and support services all have a voice. We'll also have extended conversations with areas we know will be heavily impacted, areas like surgery, heart and vascular, the emergency department, and others. The final phase is construction, which is when all designs are approved and the building begins. We anticipate opening the new tower in early 2024, but that doesn't mean we are going to wait 4 years to solve our current challenges though. We will continue to drive process improvements like opening up step-down beds and observation units to alleviate the stress some areas are feeling due to increased patient volume. If you have ideas about how to be better tomorrow than we are today, please speak up in your huddles and ask your supervisor to escalate issues that aren't being addressed. I'm excited about the future, and this plan for Northeast Georgia Medical Center Gainesville is just one of the reasons. There's also plenty of growth planned in Braselton, which seems like it's been constantly expanding since it opened 5 years ago. The latest plans can be broken down into 2 major projects. Here's a 3D view of the campus with the emergency department entrance in the middle, on the ground floor, and existing surgery areas on top. The first part of the growth plan will be to expand the existing Nicu on the 3rd floor from 4 beds to a total of 14 beds. The 14 beds will be split between a traditional Nicu setting and a new section that will function like a Nicu step-down unit. The second project will include expanding the emergency department on the ground floor to almost triple its current size. The expansion will add new treatment rooms, an emergency observation unit, and waiting areas. Additional space will also be added to relocate and expand the laboratory and pharmacy. And the existing lab and pharmacy space may be used to expand sterile processing and food service areas in the future. Expanding these services will also increase the need for parking, so we'll explore options to add spaces as part of this project too. There will be 3 overall phases for the Braselton expansion as well. Just like in Gainesville, the planning phase is complete. Now we're moving into the definition phase and starting conversations with physicians, nurses, and staff in the areas most impacted to validate the plan. The final phase is construction. We anticipate completing the Nicu expansion in late 2021 and the emergency department expansion by the end of 2022. Those are all the plans for Braselton and Gainesville, but there are plenty of other projects in the pipeline across the region. Some of the larger projects on the horizon include building a new complex along Highway 316 in Barrow County, renovating and expanding our footprint near downtown Beaufort, and opening a new hospital along Georgia 400 in Lumpkin County. We're also continuing to invest in other important projects across our health system, like equipment and technology improvements and renovations and updates in other hospitals and clinics. I can't wait to see all of our projects help us in growing the greater good. If you want to learn the latest about upcoming plans as they're available, visit ngaHS.com/growing. I hope you are as excited about the future as I am. Thank you for all you've done to get us where we are today, and for continuing to work together to improve the health of our community in all we do.